As you know, we've been talking about the triple-demic for weeks and how hospitals are really struggling with capacity and a shortage even of medication.
Yeah, we want to take a deeper look at the flu, just the flu, and how dangerous this illness is. In 2 short months, about 120,000 people have been hospitalized by the flu. 7,300 people have died from it. Joining us now is NBC News medical fellow Dr. Akshay Syal. Dr. Syal, thanks for being here. So let's talk about this, because I think sometimes people underestimate the power of the flu and how dangerous it really is. Who's at risk of having the most serious complications?
Yeah, good afternoon, Morgan, Vicky. It's a great question. You know, what we see with those numbers of the flu, you know, most people, to be clear, will be fine and will recover from the flu in a matter of about 2 weeks. But there are some groups of people that we worry about to have more severe complications. You know, people over the age of 65, those with weak immune systems, those with, especially who are pregnant. I mean, I think this one is one that surprises people, because even if you're healthy going into your pregnancy, you know, your body changes a little bit. Your heart and lung function changes, and your immune system.
A lot of it.
A lot of it, yes. And your immune system changes too. And for that reason, pregnant patients are at a little bit more risk of severe flu.
Okay. When you talk about complications, what exactly are those complications?
So the most common one we see is pneumonia. You know, I've been seeing this basically every day for the last few weeks in the hospital. You have patients who, you know, maybe they have asthma, maybe they have lung disease, and they're more susceptible to getting things like pneumonia. But there's a whole host of other things we worry about. You know, inflammation of the muscle called myositis. It can even lead to muscle breakdown called rhabdo, something you've probably heard about after a marathon. It can lead to inflammation of the brain called encephalitis. So, you know, to be clear, these things are not common, but they are something that people should be aware about, because when we think of the flu, we don't really think of things outside of body aches and fevers and chills. So it's just something important to be aware of.
And you talk about flu lasting 2 weeks. I mean, 2 weeks of being sick is a really tough time. We're right here now in the middle of flu season. Is it too late to get your flu shot?
Absolutely not. The flu shot takes about 2 weeks to kick in. 2 weeks from today is about Christmas time, when people are going to be traveling, spending time with their loved ones, being in indoor gatherings with people who may be at high risk. Definitely go and get it this afternoon, maybe right after the show, as that way it gets some time to kick in for the holidays.
I don't know, but when I was growing up, I always heard this myth that, like, if you get the flu shot, then you're going to get the flu right after. Is that a thing?
I love a good game of Mythbusters. No, that is not a thing. The flu shot basically contains a particle designed to teach your immune system how to fight the flu. The other, speaking about Mythbusters, if you've had the flu, still get your flu shot. The flu shot protects against 4 strains, and if you've had the flu, you probably only had 1 strain, so you want that extra protection as well.
That's good. Oh, God, can you imagine getting the flu twice in one season? That would be terrible.
Especially now, with COVID and everything else going around. All right, NBC News fellow Dr. Akshay Syal. Thank you so much, Dr. Syal. We appreciate it.
Thank you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.